Good afternoon or good evening, everyone, depending on where you're joining us from around the world. My name is Erica Ruggiero, and I'm the director of the Center for Global Health and an associate professor of global health at the Dell School of Public Health at the University of Toronto. And it's my pleasure to welcome you to this webinar. It's a webinar that our center is co-hosting with the Center for Sustainable Health Systems, led by Fiona Miller, at the Institute of Health Policy Management and Evaluation at the Dell School. Before we get started and I introduce our wonderful panel, I just want to take a moment to acknowledge the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples, on which the Dell School of Public Health now stands. The territory was the subject of the Dish with One Spoon Wombat Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. And we'd like to also pay our respects to all of our ancestors and to our present elders. This is an important acknowledgement that we do at the beginning of all of our meetings and classes. I think it's especially relevant to the topic of today's webinar focused on environment, given the strong relationship that Indigenous people have to the land. So this webinar is actually the first part of a two-part series that our two centers are organizing, which will focus on the links between the environment and COVID-19. And we will, in a subsequent webinar, and I'll say a bit more about that towards the end of this one, how the health sector has responded or not with sustainable solutions. So I think, as everyone knows, COVID-19 has clearly disrupted our economic, social, and health systems, but it's also shown us some of the benefits of reducing our consumption patterns, which, if sustained, can have a positive effect on the health of our planet and its people. And unlike COVID-19, climate change is not a new global emergency. So during this webinar, we'll explore the global political and economic drivers of climate change and environmental degradation, alongside the relationship between infectious disease patterns and climate change, and also speak to the role of different sectors and actors, including our students, in really responding to these crises through environmentally sustainable solutions. So I really am very pleased to introduce our panelists. I will say a brief word or two about each of them and then invite each of them to speak in turn. We will then have time for a follow-up discussion. And as you're hearing these talks, please take a moment or two to use our chat function to direct any questions you may have at one or more of the panelists using the Q&A function of this webinar. And if you have any questions after the webinar, please do send them to globalhealth.dlsph@utoronto.ca, and this email will be shared in the chat box. So without further ado, I'm pleased to introduce first Chris Buse, who is a CIHR postdoctoral fellow at the UBC Center for Environmental Assessment Research. Chris studies intersectoral responses to the health impacts of environmental change using social science, epidemiological, and community-engaged research strategies. His research really seeks to understand environmental health outcomes that manifest as a result of dynamic interactions between social, cultural, economic, and ecological systems, and to use that research to respond to some of the world's most pressing sustainability and equity challenges. He holds his postdoc at the UBC Center for Environmental Assessment Research with two areas of focus: piloting integrative impact assessment methods to understand the cumulative environment, community, and health impacts of multiple land uses, and public health adaptation strategies to climate change. His PhD is actually from social and behavioral health sciences and public health policy here at the school, so it's great to welcome back an alumni. And also has previous training in sociology from UBC and political science and sociology from the University of Alberta. And Chris will kick us off by commenting on how the links between the environment and public health have played out in the COVID-19 pandemic. His brief remarks will then be followed by Samira Mubareka, who is an infectious disease physician and a medical microbiologist at Sunnybrook's Health Sciences Center. And she's also a clinician scientist at Sunnybrook Research Center and the University of Toronto. She has training, of course, in infectious diseases, and her work as a clinician scientist is focusing on the transmission of respiratory viruses with an interest in genomics, aerobiology, and the human-animal interface of viral spread. She's been working on SARS COVID-2 since the outset of the pandemic in North America with a focus on virus virology, bioaerosols and exposure, genomics and transmission through close and cross-disciplinary collaborations with engineering and many other disciplines, including virology and animal health. She also serves on the Chief Science Advisor of Canada's expert panel on COVID-19. And she'll be using examples from her own research to help shed some light on the relationships between environmental factors and infectious disease outbreaks. And then finally, Victoria Haldane is a PhD candidate in health services research with the Institute of Health Policy Management and Evaluation. She's also the founding member of the student group Emerging Leaders for Environmental Sustainability in Healthcare, or ELASH. Hopefully I pronounced that acronym correctly, Victoria. Victoria is a third-year PhD candidate at IHPME and is also in the collaborative specialization in global health. She's the founding member and co-president of Emerging Leaders for Environmental Sustainability in Healthcare, also an intern at the Center for Sustainable Health Systems and Planetary Health Alliance Campus Ambassador. And her research interests include implementation science, health systems resilience, and really making health systems better for people and the planet. And she'll be commenting on the intensification of the use of our single-use products in the healthcare sector. So without further ado, I'm really delighted to have this panel with us here today, and I will now invite Chris to kick us off.
Thanks so much for the intro, Erica, and my thanks to the organizers for the kind invitation to be here today. I want to acknowledge that although you're seeing me physically through a Zoom window, I'm actually located on the traditional territories of Syilx Okanagan Nation in the beautiful city of Kelowna, British Columbia, and to pay my respects to their elders past, present, and future. I was tasked with giving kind of a 10,000-foot orientation of both environmental influences and outcomes in a very short 8 minutes. So I'm going to rush through a couple of different things here, but my two big takeaways for today are that first, COVID-19 and other emerging environmental health challenges of the 21st century, whether they be climate change, biodiversity loss, increasing land use degradation, they all reflect an unhealthy relationship that we have collectively with the environment. And in a moment, I'm going to share some information about everything from animal health to medical waste, air quality, and climate change and environmental safety to that end. Second is that as a discipline, public health actually is equipped with some really great tools and processes to understand this complexity. So I'm going to end my brief opening remarks with some of those tools and takeaways. So certainly there's been a lot of speculation around kind of the emergence of the SARS pandemic, or sorry, the COVID pandemic globally. There's a lot of really interesting connections to previous pandemics, whether they be MERS, SARS, or Ebola. There's been considerable speculation that a lot of these new and emerging infectious diseases will continue to pop up as human populations have greater interactions with wild places. And the point that I want to make here that these are largely driven by extractivist neoliberal rationales for development. They're rooted in an ideology of domination over nature, that nature is something to be consumed and utilized for human gain. Certainly the capture and trade of live game, which was implicated early on in the spread of COVID, at least in terms of jumping species barriers, is a really complicated issue. There's been a lot of speculations around the origins of the virus, potentially coming from a wet market in Wuhan, where many people's livelihoods rely on trading rare animals and wild game to support themselves. And for me, this raises, again, some really important questions about interdependence between the biosphere on one hand, the economy on the other, and human health, certainly, and the need to ensure adequate work and protections for people that doesn't create new opportunities for virus spillover events or further ecological disruption. We've also known that not only do the drivers of the pandemic reflect unhealthy relationships with society, but suffice it to say, we've had a real mixed bag of good news and bad news in terms of environmental outcomes related to pandemic protocols and our global shutdown, many of which are related to us, again, kind of staying at homes, especially during the early days of the outbreak. This is a This slide is just a small sample of some of the things that we've taken notice of during the pandemic. But my big takeaways, certainly on this slide on the left, where we've seen a 40% estimated increase in global medical waste use, and a really interesting recent publication by Prada et al. In the Journal of Environmental Science and Technology that estimates that monthly across the globe we're using up to 129 billion single-use face masks and 65 billion pairs of gloves per month. Not to mention certainly emergent environmental health issues related to things like accidental poisoning from alcohol sanitizer exposure. When we come to the next side of the chart on the right-hand side, we know that we've seen significant reductions in greenhouse gas emissions and certainly evidence of local improvements of air and water quality. And I want to just spend a really brief moment talking about some of the connections that we've seen between global climate change. The article that you're seeing on the right here is a recent publication in Nature Climate Change that was doing some modeling work looking at global reductions of greenhouse gas emissions as a result of our pandemic response. And really what they've found was without adequate investment in a kind of green recovery, really the slowdown, the economic slowdown resulting decrease in global greenhouse gas emissions is likely to be a blip without adequate action. And we know that according to the chart on the left, we actually have a really bad track record of slowing greenhouse gas emissions in the wake of economic crises. So we've certainly seen this over the past few months as global leaders have kind of rushed to restart the economy, in Justin Trudeau's words, to bring the economy roaring back. And without suitable foresight, the trajectory that we're roaring back to is one of climate calamity and increased climate change impacts. This brings us to another really interesting overlap when we start to think about COVID pandemic response and things like some of the climate-driven emergencies that we've seen roll out across the world, even just this year in 2020. The photo on the left here is a photo in Georgia. This is right during the heart of tornado season in early April. You can see some of the devastation that was caused. And of course, as we're setting up emergency response centers to house people and provide care and food and water and supplies, there's a recognition that our practices in those spaces need to be adjusted for a COVID-stricken world. And certainly in what is on record now as the worst fire season of all time for the West Coast of the United States of America, as exemplified by that startling image in the top right, our emergency response protocols, again, need to be taken into consideration and really pose significant questions for how we respond given this overlapping complexity. I think it's worth mentioning in the brief time that I've got that additional environmental impacts also manifest locally in terms of the places where we live, work, and play. And certainly as we saw the pandemic response as a mass rollout for public safety, we also know that we've seen over the last 10 years this incredible surge in research exemplifying the health benefits of connectedness to nature. And so as we're all kind of sheltering in place and staying at home and following stay-at-home orders, some really significant questions for those of us who work in the environmental health field start to come about, right? What if my home is unsafe? What if my home has unsafe indoor air quality? What if I am in a situation, certainly where we've seen statistics of domestic abuses rise as a result of being in close contact? I think we've all certainly felt some of the stress and anxiety of not being able to leave our homes. We know that mental illness and acute anxiety, addictions and loneliness have all been spiking as a result of our pandemic responses. And then certainly some really significant questions that if we live in an area that is situated next to a whole host of undesirable land uses, that's polluted, that has poor air quality outdoors, it raises some really important questions about, what if I have an unsafe neighborhood, or what if I have inequitable access to nature? And we certainly know that lower income non-white populations in North America explicitly tend to live in closer proximity to those sites and have differential exposure to all types of environmental pollution. So it's not all necessarily bad news, though, as a result of the pandemic. In the field of public health, we've been working over the course of the last 150 years to develop new ways to recognize some of these interconnections between environments, humans, non-human animals, and ecosystem health. And really the point that, these kind of 7 emergent fields of study in the environmental health sphere are offering is that we really need to reconcile these relationships. We need to reconcile that unhealthy relationship that we have collectively with nature. And we can do that with some really great tools. So certainly recognizing nested ecological scales to understand that interplay between in some cases, local sensitivities and local exposures, but also global conditions that might either cause a particular emergent health outcome to manifest. The equity considerations, which I've spoken to a little bit, but really to understand what's right, fair, or just in terms of our response to either an emerging pandemic or global climate change, for example. And then certainly some of the really great learnings that we've got from environmental health in fields like One Health around host and vector interactions, to recognize again that many of these emerging infectious diseases will likely continue to result from that unhealthy relationship that we have with other species that we share our common home with. So I'll leave it there for my opening remarks. Happy to pick up some of these threads in our discussion. And again, thanks to the organizers for having me today.
Thanks so much, Chris, for that tour de force. I know that was a daunting task to be able to cover some of those many important relationships, and your focus on trying to redefine those relationships with nature with attention to equity, I think are really important among the many threads that you laid out for us. So I'm going to turn things over to Samira to kick us off with her presentation.
Thank you very much, Erica. I hope you can see my screen. I will put it into slideshow mode here in a second. Okay, so thanks so much for that, Chris. The messages that you conveyed are incredibly powerful, and at some point I'd like to have a conversation with you offline about this, because I think that one of the challenges that I've noticed has been the clear presence of silos. Virologists who study zoonotic diseases, we work in our own little world, and similarly, other disciplines, be it ecologists or mammalogists, tend really not to overlap very much. And I think that there's a clear opportunity here to mend some of those fences where they've been broken, and also try and bridge some of those important gaps. I know for myself, in terms of what really was the turning point for our work, was framing the questions we were asking in a very different way. So as a virologist, I took a very typical approach before. We designed and conducted experiments, we reported them, and then we designed more, and, you know, really without stepping back a little bit and thinking about the broader picture. And the question for me anyway, that really reframed our work, was thinking about, we work on viral transmission, primarily respiratory viruses, but also other viruses like arboviruses in a more recent project. And we had to start thinking about, where are the viruses? Where do they actually live? So a lot of our work started off at the hospital, which is where I'm based, looking in patients, but then through some collaborations with people in animal health and medical entomology, wildlife biologists, really started going where the viruses actually are. So this picture is, I picked a snowshoe hare because that was actually one of the first viruses that we started working on, was a snowshoe hare virus. And it's probably a virus you've never heard of before. It's actually present in Canada, and it does cause encephalitis in humans, and has an animal reservoir. And some of these viruses that have animal reservoirs also cause disease in animals. And that's often been a very overlooked aspect of this work. So I really like to show this particular image about viral and other pathogen emergence. Really, we get very excited. We start talking about and funding work once something has actually emerged. You know, localized emergence does gain some traction, but that much less so. But really, almost completely neglected is looking at viruses and other pathogens before they emerge. So what we call the pre-emergence phase. Now, there's a little bit of attention that's granted, well, quite a bit of attention actually, that's granted to domestic animals, particularly livestock. And that's because of the economic implications. It's not necessarily for the sake of animal welfare per se. And I think if you think back to mad cow disease and other pathogens that threaten the food supply, a lot of the push came from that aspect, but almost completely neglected is the wildlife aspect. And you really can't think about viral habitats in wildlife without actually thinking about the ecology and the environments that these animals live in. And this is really where the penny dropped for me a couple of years ago, and kind of reframed our approach. And since then, we've been able to collaborate with so many people who have taught me a lot about thinking of things through that lens in particular, and not through a classic reductionist scientific lens, because it's quite evident now, but it's clear that all of these are very closely interrelated. So the virus, whatever pathogen in focus, the animal host, there may or may not be an arthropod vector like a mosquito or a tick, and then human and other species in proximity. And so as we enter the Anthropocene, we're well into it now, I think. We have to think about these things from a different perspective. It's really insufficient to think about transmission just at the viral level, or even at the route of transmission, the level of the route of transmission, whether it's bioaerosols or respiratory or fecal oral or whatever it may be. It's really clear that it's been a crucial step to understand how these might intersect. And by these, I mean specifically pathogens, reservoir hosts, and other species. And if we think of that other species as humans, as an example, you can start thinking about what we call edge effects. So this is where different habitats may collide. And a point or a case in point that we can think about is SARS coronavirus 2. So if you think about SARS coronavirus 2, and really the highest incidence of COVID-19 is in highly populated areas, but some of those highly populated areas actually border farmland and forests. We know now that the virus has made its way into wastewater. Whether or not that can actually be a route of transmission, we do not know, but it certainly opens up the possibility that a much broader range of species, be they domestic, peri-domestic, or wild, are actually being exposed to the virus. And also, it forces us to think about how mitigation could actually be focused on these edge effects, or where these habitats collide. First of all, we haven't even really looked, right? We don't really know whether the virus has spilled over into any wildlife populations. I think it's abundantly clear now, you've probably heard in the news recently that it spilled over into mink and then back into humans. So that's an example of viral zoonoses, and then reverse zoonoses or anthropozoonoses, which then flip back to zoonoses. So in Denmark, this has happened and it's very clearly documented. And while circulating in mink, the virus actually changed. So when it spilled back into humans, there was a different lineage or cluster. And some of those changes appear to potentially impact antibody activity against the virus. So we're putting animals at risk, and we're putting ourselves at risk if we ignore this any further. So, we know that zoonotic viruses are found in abundance depending on a couple of different things. We know that it depends on how diverse the animal species are. So animals like rodents and bats are incredibly diverse. So we tend to find a lot of zoonotic viruses in those hosts. We also tend to find a lot of zoonotic viruses in animals that are incredibly abundant on the planet. And we know humans are the most abundant animal on the planet. So obviously we host a significant proportion of zoonotic viruses. And then second to that are the animals that we have intensified husbandry and raising for, so i.e. livestock, so cattle, sheep, pigs, poultry, etc. So really we've done ourselves an immense disservice. It was what we would call maybe an off-target or follow-on effect of our attempt to secure the food supply, but it's been incredibly misguided from that perspective, and I think clearly from a climate perspective, which I won't speak to right now because it's not my area directly, but I think that there are at least two fronts that our current farming practices have borne a significant disservice for the health of not only humans, but animals as well. So moving on to SARS-2, and maybe a little bit back into, I guess, more my traditional habitat, which is the lab and the hospital. I perpetually feel conflicted because, I see patients all the time, and in the process using vast amounts of PPE. I'm not really given much of a choice, to be honest, if I want to practice, but it feels absolutely awful. And another place where we do tend to consume a lot of reagents and plastics and almost all single use really is in the laboratory, and the level 3 laboratory is sort of the epitome of that. So we've been doing a lot of work in level 3. We isolated the virus in level 3 here at the University of Toronto. This is the getup that people are in there wearing, and this is an example of the cytopathic effect of SARS coronavirus 2 in cells. And you can see here an electron microscope. This is a picture of the virus actually budding out in a cell. And it's very difficult to try and reconcile, how can we do this work? How can we look after patients, and how can we do this work without generating so much waste? But there's no question that there are potential solutions around that. But I think that that's an area that people have not even considered. It's not even a second or third consideration. It's not a consideration in many settings at all. So I think that that needs to change, and change in short order. If we think about some of what we've been doing from an arbovirus perspective, we've really been looking at transmission of viruses, where they overlap with vectors. I'm not going to take too much time to think about this in the time frame that we have, but I just wanted to show this slide to say it is beyond SARS coronavirus 2. We do need to think about some of the other viruses, and any arthropod-borne virus, or what we call an arbovirus that's transmitted by a mosquito or a tick, is very likely to start increasing in activity relative to climate change, which has a huge, huge impact on mosquito populations, both range and geographically. So I just want to leave you with, this is a very moving message that just came out today. I think probably most people on this webinar understand this already, but really it was a very, very clear message from Antonio Guterres today. Human exceptionalism really needs to change. We've put human health, well-being ahead of everything else, and I think that we are now facing the consequences of that attitude. And we need to start changing the mindset in this regard. And I really like, Chris, what you mentioned. You talked about interspecies equity, and I think that that's something that needs to enter the narrative and be at the forefront of the narrative going forward. Thank you.
Thanks so much, Samira. I think you raised some really important themes, including the importance of bridging some of the disciplinary gaps that kind of reflect how we're trained, and to really bring all of those talents together to solve complex infectious disease and other problems, and the perils and the consequences of neglecting the study of wildlife within the context of their own ecosystems, and also how some of our practices are contributing or further aggravating these problems. And I love the way you ended this presentation about an important reminder about the perils of human exceptionalism. So you've given us a lot of food for thought, and thanks so much for joining us today. Look forward to the discussion. And so now over to Victoria for some reflections as well.
Great, thank you. And hopefully we can play from start. All right, well, thanks so much. Those were certainly tough acts to follow, and my slides definitely pick up on some of the important points that were made. So bear with me and we'll take a walk together. As I am sure many of you know, and as my co-panelists have so well described, climate and environmental change are really the greatest threats to human health and well-being of the 21st century. There are many ways that human activity has negatively impacted the planet, and this includes destruction of habitats, greenhouse gas emissions, air pollution, waste mismanagement, water contamination, and many, many more. So by the end of the century, climate change, if unabated, is conservatively projected to contribute to an additional 3.9 million deaths per year and an enormous burden of morbidity globally. Emerging zoonotic diseases such as COVID-19 are really symptomatic of greater planetary imbalances that are instigated and perpetuated by human activity, as Chris and Samira so well put. And outbreaks and pandemics will then increase the resources consumed by health systems in order to provide safe and high quality care and protect the health workforce. So it's been estimated through a life cycle assessment that in the first 6 months of the COVID-19 pandemic, the carbon footprint of personal protective equipment supplied to the health and social sector just in England alone was over 150,000 tons of carbon dioxide, the equivalent for the emissions. And that's equivalent to around 65,000 return flights from London to New York. And with widespread use of disposable masks and gloves, not only in healthcare settings, but also in communities globally, the true impact is likely much higher. But I think that what part of COVID-19 has done in so many ways is shine a spotlight on where our systems have been failing us. And in the case of single-use products, also failing the planet. COVID-19 has made very visible how much we rely on single-use products in delivering healthcare. And of course, there was a real need for PPE to provide safe care during the pandemic. But now the idea of wearing a mask to protect others and ourselves has entered the public realm, and this resource consumption is a lot more visible. And in communities worldwide, there have been a lot of solid information campaigns that provide public health and environmental sustainability guidance. So to use reusable masks to conserve medical grade masks for healthcare workers, or washing your hands instead of wearing disposable gloves. But these individual actions, while important, they really only go so far, and they can distract us from the very real need to rethink and transform our systems and procurement processes within the healthcare sector. So what is now a part of public discourse is just making visible a longer standing issue of the intensification of use of single-use products in healthcare that predated the pandemic. And the carbon footprint of the healthcare sector has been problematic long before COVID-19. So some of the key aims of healthcare are to decrease the burden of disease, improve quality of life, and strengthen population health. However, despite this reality and healthcare's mandate really to do no harm, even before COVID-19, we consumed vast amounts of resources and were major contributors to greenhouse gas emissions, which do harm the planet. So if the healthcare sector were a country, it would be the 5th largest emitter on the planet. The Healthcare Climate Footprint Report, which was published in 2018, was really the first report to calculate the carbon footprint of the global healthcare sector. And they determined that the climate footprint of healthcare was 4.4% of net global greenhouse emissions. The majority of healthcare's emissions come from the healthcare supply chain and the energy used to make, transport, and dispose of items used in healthcare, such as syringes, PPE, and pharmaceuticals. And this is then followed by operational emissions, or the building itself and the attendant vehicles used to deliver or convey people to care. And finally, indirect sources from purchased energy, or how green the grid is that then fuels your healthcare system. Now, in Canada, we have the 3rd highest per capita greenhouse gas emissions from healthcare in the world, with healthcare accounting for approximately 4% of the country's total emissions. A recent Canadian study has shown that life cycle greenhouse gas emissions from healthcare, including the supply chain and waste disposal, increased 10% from 2009 to 2014. And that's definitely not the direction we want to be going. In 2018, there was 36.6 billion metric tons of carbon dioxide emissions globally. Environment and Climate Change Canada estimates that each metric ton of carbon dioxide emissions will require $41 in future healthcare costs to Canadians. So $41 times 36.6 billion metric tons is clearly a big problem. And these emissions are a transboundary threat to health. So it's not only Canadians who pay the price of our system's carbon footprint. Our healthcare emissions directly and inequitably impact the health and well-being of communities worldwide, with greater impacts on the health and well-being of Indigenous and equity-seeking groups here in Canada, as well as globally. So given that our mandate in healthcare is to do no harm and to protect the health of our communities, the healthcare sector has an undeniable responsibility to act and transform towards systems that protect and promote the health of people and the planet. So these actions include adaptation, or actions that reduce the negative impact of climate change that's already happening. This includes training the health workforce to be able to respond to climate-mediated events such as heat waves or the expansion of vector-borne disease ranges, treating Lyme disease, dengue in places where it never was before, as well as traditional risk management and contingency planning to ensure that health service delivery continues in the face of climate change, so that while wildfires rage in British Columbia and Northern Alberta, the hospitals are still running and able to provide care to people in need. We also need to mitigate. So these are actions that reduce the flow of greenhouse gases into the atmosphere, either by reducing sources of these gases or enhancing the sinks that accumulate and store these gases. In healthcare, this could include interventions such as using a lower impact anesthetic gas, because as you may know, anesthetic gases are greenhouse gases, but some stay in the troposphere longer. So there's been a lot of work towards greening anesthesia practices. And really, above all, we need to be bold and we must lead. The NHS in the UK has already committed to actively decarbonizing their health system with a goal of net zero by 2050. So the precedent has been set. And now, health systems across Canada must take action towards net zero and decarbonized health systems. We all must be a part of this effort to bring systems transformation. Patients, caregivers, trainees, healthcare workers, policymakers, everyone needs to be a part of this conversation. And one of the ways trainees here at University of Toronto have mobilized is through the formation of emerging leaders for environmental sustainability in healthcare. So at ELSH, we know there is a lack of training, education, and consideration of the environment in many health programs. We advocate for an environmental sustainability lens to be considered in the diverse disciplines that deliver care and contribute to health systems. Our approach is interdisciplinary, and it's really grounded in action and advocacy and starting this conversation. So as part of this commitment to advocacy and action, we partnered with the Centre for Sustainable Health Systems and the CIHR Institute of Health Services and Policy Research to convene a Pan-Canadian Trainee Committee on Environmental Sustainability. Through our roundtable discussions, we conceptualized this framework, or what we call the 3C approach, for applying an environmental sustainability lens to health services and policy research. This work must be grounded in a justice-based approach, and through funding and support, we must transform our curricula, conduct, and content to ensure environmental sustainability is considered across the research process. So this work is ongoing, so keep an eye out. And meanwhile, we've been holding workshops with trainees to ideate on this and develop it further. And if you're a trainee or anyone really who's interested in learning more, please reach out. This is something not actively taught in our programs, but is the greatest challenge that we will face as emerging leaders. So really, it's up to us to capacity build ourselves and to empower others to be able to transform our health systems to be better for people and the planet. Thank you.
Thanks so much, Victoria, for really laying out some of the important roles that the health system plays in protecting us, but also some of the waste considerations and that important call to action to all of us to really address some of these very systemic issues. I'm going to actually suggest we move directly into some of the questions we've been getting from the audience. And so one of the questions that has come in is, and Chris, maybe I'll direct this one at you because you started to answer this, but is this time for humans, at least more wealthy humans, to stop eating meat, for example? It seems that this would decrease transmission pathways through factory farming and through alternative means for food production and distribution. So any thoughts on the meat question?
Yeah, it's a good question. I'm harkening back in my youth to some of the really kind of interesting spillover events that we had around mad cow disease here in Canada, and really kind of my early interactions and engagement with that led to some really deep questioning. Is this something that we should be doing? Is this something that I should be putting in my mouth? Is it safe? You know, there's been a lot of really large scale reports. I wrote in one of my answered questions in the Q&A block that I think people can see now. The Eat Lancet Commission has certainly put out a lot of advocacy around the benefits of moving towards a plant-based diet. Increasingly, professional associations that are popping up in this space, like the Planetary Health Alliance, are advocating for either a vegetarian diet, a vegan diet, or at a minimum, a reduction in meat. And so one of the things that I advocate for with my friends, and I'm born and raised from Alberta, so I used to live in the heart of cattle country. It was not uncommon for friends and family growing up to eat steak, you know, multiple times, multiple meals per day. I think it's a useful entry point just to suggest that, you know, a diet of meat reductionism can go a long way, not only to improving health, but also to improving sustainability goals. So finding ways to just slowly but surely start to cut it out, replace it with plant-based proteins. There's lots of options out there that are a little bit more environmentally friendly and a little bit less resource intensive in terms of their production, that are good for people, good for the climate, and good for the land. So certainly something that's being increasingly advocated for.
Super, thanks so much for those reflections. I think one of the challenges is that food like meat is not just something that you consume, but it's also very culturally, defined. And so making quick fixes or switches is not easy to change those kinds of behaviors. We have a couple of questions that are really trying to pick up on equity and justice, which several of your talks really address. So maybe I'll turn my attention to some of those discussions. So one of the questions was, what are some of the ways in which the global pandemic were and how it's disproportionately affecting vulnerable communities, so Indigenous peoples, people of color, people with disabilities. How is the pandemic affecting those peoples? Any comments on that? Victoria, maybe I can ask you, because I know social justice and equity was a key theme in your talk as well. Any thoughts on that?
Sure. Actually, looking at what Chris has answered, I would echo it entirely. So this may be a bit redundant if you've been reading the chat, but I also think that when we are thinking of environmental justice and social justice, it's also reframing from vulnerability to a strengths-based approach and looking at what we can learn from communities, because yes, communities have been disproportionately impacted and have been systemically oppressed, but there is a lot of resilience and strength within these communities that we can learn from and really elevate. So I think also tackling the roots of oppression, looking at racism as a public health crisis, capitalism as a public health crisis in many ways, and starting to target these broader structures. I think it's my public health showing, always going further and further upstream.
Bring it on.
But I think that's, yeah, I think that's an important way to look at these issues and really drive at an equity-based approach, is listening to communities, being involved in communities, and drawing from the strength within communities for sure.
Yeah, well, I think it actually one of the it was more of a comment from one of our participants, is that how we'd like this discussion to really be part of the mainstream discussion, which is always a challenge. So maybe this next question for you, Samira, because I know you sit on the COVID-19 panel and provide scientific advice at multiple tables. So the question is that I feel the concept of COVID being a zoonotic disease and connection with habitat and destruction and human encroachment, and its relationship to the climate crisis is not really being highlighted enough in media and in conversations among physicians. So how can we help the public and healthcare professionals make this important connections? Any thoughts on that?
Yeah, that's actually a question that's come up. This is the second time this week that this question has come up. So it's clearly top of mind. And you're absolutely right. And the same thing happens with influenza virus. Influenza spills over from wildlife reservoir, but we just think of it as a human disease because, the vast proportion of cases are from human to human transmission, and we forget to go back to the origin of it. And I think luckily, I think that this theory has been put to rest, but also at the outset, people were speculating that maybe it was lab derived, which it clearly was not, which I think was a little bit of a detraction. And it's not just SARS coronavirus 2, Ebola is the same story, as are a number of different arboviruses. And, I think what's happened is that because we've lost our connection with nature and the natural world, we don't perceive health in animals as a benefit to human health. And I think that might be one place to maybe start and, really make that link very clear that, and it's not just animal health, it's environmental health too. So if our planet is healthy, if animals are healthy, we will be healthy. And I think that that's a perspective that we've kind of lost. And I think there's also been a narrative which needs to be a little redirected of nature as a threat. People talk about biothreats and bio risks and biohazards. And really, we are the risk and the hazard to ourselves and to nature. So I think we, as scientists, probably need to be a little bit better at communicating this publicly. I know a lot of us feel very comfortable talking in our lane, but even other infectious diseases that aren't directly linked to my work, I defer to someone else because I tend to stay in my lane. But I think maybe we need to get over that and maybe be comfortable to step out of our lanes and do it maybe in collaboration with other people on this panel. And that way, it feels a little bit more, you're not speaking out of turn or out of your own mandate, beyond your own mandate, I mean. I think that might be, I think we need to maybe organize a bit better.
Yeah, no, I think you raised, returning back to your point around bridging between disciplinary divides. And also, I think, Chris, you talked about the redefining our relationship with nature. Did you want to jump in on this question as well?
Yeah, just really briefly, I agree with everything that's been shared so far. I think Samira made some really great points. I think the other thing that I'd add, we have a bad track record, both in the medical sciences and in public health writ large. This path dependency in terms of how we respond to crises. We're very deeply steeped in a highly reactive, risk management oriented practice. And what we're starting to see the emergence of some of these new environmental health paradigms that have started to pop up over the course of the last 50 years is this broader, deeper recognition, the need to have almost a boilerplate statement on anything that we do that says human health is dependent on a functioning and flourishing biosphere. That is the foundation for all of these things. Everything that we've talked about today, whether it's equity, justice, it all requires a functioning biosphere. So that to me is a fundamental kind of reframe that we need to be start thinking. And it really nicely picks up on Victoria's point around keep going upstream, keep paddling, we can get there.
Yeah, so it's like really changing the narrative as well. Victoria, did you want to jump in? Because I think you touched on it from a curriculum perspective as well, in terms of the gaps as well.
Yeah, I think a lot of it comes back to these conversations that we need to have. And at least in our work with ELISH, it's been talking to people in other disciplines to learn, to figure out how we can speak the same language, and to get to Chris's point of going upstream and realizing that it is about having a functioning biosphere and having planetary health. So I found the planetary health discourse to be quite helpful in that. But of course, there's all these different paradigms that you can point to and call on to take you towards the same place. And I think, yeah, we just need to keep having those conversations, even if they're difficult or we're coming from our different interdisciplinary lenses. If we can apply an environmental lens to things, that helps. Something we're trying to do amongst students is like, look at we're all on various different research topics, but how can we apply an environmental lens to what we're doing? How can we bring that into our work? Because there is this divide, I think, sometimes between people's personal habits. Like you may, use a reusable bag or not invest in fossil fuels with your personal finances. But then when it comes to our work sphere, there's this gap and we don't know how to bring that activism and that advocacy into the mix. And I think we need to start having conversations about how better to do that, because it's possible. It's just that lens we need to apply.
So here I have a question, which I'll sort of throw out to anyone who would like to answer it. And is there actually any emerging research or evidence that we can point people to demonstrating that COVID is linked with climate change?
I can take a crack at it.
Do you want to take that one for 100?
I haven't seen a lot of compelling evidence that suggests that climate change is a cause of COVID-19. There have been some analyses that have looked at, different latitudes, distribution of global temperatures, incidence of the disease, and there doesn't seem to be any type of established pattern. We do see, I think there is some emerging evidence around kind of local environments, the roles of things like air pollution and ambient temperature, the ability of the SARS-CoV-2 virus to stay on things like particulate matter in air, for example. The survivability of the virus in those contexts, I think, is still a question that we need to understand a little bit better. But I haven't seen anything super compelling that suggests that climate change is a considerable driving force in terms of the emergence of COVID-19. Samira and Victoria, I'd be really keen to hear.
Yeah, feel free to weigh in. Samira, did you have any thoughts on that?
Sure. I think that trying to draw a causal relationship is more difficult, but I think there are clear associations. So, probably 800 years ago, one of these coronaviruses spilled over from cattle into humans, and that's one of the causes of the common cold. The difference here now is that because of global travel, mainly by people who could afford it, there was a catalyst for very, very rapid spread right across the globe. So, again, there are associations, obviously, in the sense that, unmitigated travel is associated with climate change. It's also associated with, which then, leads to pollution. There's no question, I think, now that particulate matter does make COVID-19 worse. And then, again, all these associations that have been linked with COVID-19 that relate to climate through association. So again, we're going to now be dealing with decades, if not centuries, of waste that's generated from all the personal protective equipment and laboratory consumables, etc. So COVID-19 is actually probably going to perpetuate climate change because of all the waste that we've generated from it, which will potentially enhance the spillover of other infectious diseases like arboviruses. So again, everything is so interconnected, both over space, but also over time. If we think about the legacy we're leaving now, we're not, even though there have been some reductions in emissions, I suspect this is at least partially offset with the waste we've generated.
Yeah, no, I think you raised some really important points around, sometimes we get trapped into sort of scientific paradigms about trying to demonstrate causality when associations are really sufficient to be making productive changes. I'm going to pivot to the next question, and Victoria, maybe I can ask you to respond to this one. So one of our participants reflects that health as an outcome is usually more visible and personal compared to the climate crisis, which can appear in the future or elsewhere. Sort of, we'll think about it later. You know, this is, I think, a common problem with the lack of sufficient action on climate change. So how do we make that link between the two more concrete so we don't continue to discount the future?
Well, I think in answering this, my bias as a trainee and a researcher is definitely going to show. I think a part of it is having conversations, as I've said. I think the first thing to do is we have to start talking about it. I think as trainees and researchers, we also have to start doing the work to bring us together, to be interdisciplinary, to make it a priority. So I know that with ELISH and in health services and policy research, we're bringing it to our funders, we're bringing it to our schools. We're really driving it as this is important to us. And I mean, that only goes so far, but it's better than not having gone at all. So from my trainee perspective, I think we need to keep talking about it. We need to keep embedding it. We need to keep putting that lens. We've seen it in other places. You know, now if you apply for CIHR funding, you have to think about the sex and gender lens of your work, which is so crucial and so important. But years ago, that would have been a crazy thing to even propose to do. Now it's completely normal. We don't even think twice about it. We all receive training. We know. Why can't we do similar things with climate change, with environmental sustainability? I completely think we can. So I think a part of it is this normalization process, and I think it really starts with trainees as well, and it's this co-creation. I think a lot of getting towards those linkage, we'll be doing the back end work of co-creating the importance, putting it in our curriculum, putting it in our trainings, having, you know, whatever it takes to get students. We already are fired up about it, but to kind of break down that compartmentalization where, you know, a lot of us students, we're already at the climate rallies, we're there. How do we bring that over and normalize it into our training, our education, so that it can then be embedded in our research agendas going forward? And I always find at IHPME and at Davalana, you know, we're the health systems and public health leaders of tomorrow. Okay, well, this is the greatest threat that we're going to be facing in this century. So we really need to capacity build ourselves, capacity build others, and work with people, work with the faculty, the staff, like my co-panelists, and start to drive these conversations forward. So that's my,
I have one
got a
thing
little sassy there.
I'm going to really briefly share one slide because I think it's such a great question. And for me, it's a question that I've thought a lot about, and I continue to come back to the question, well, what's working in terms of how we're communicating about the pandemics? Like, I think the question is spot on. We're talking about something that is a very acute health crisis. When it manifests, we're seeking often emergent care to deal with it. Whereas climate change is this thing that's seen so far off into the future. So that dimension of temporality seems to be separated between the two. And the point that I come back to is, we know that climate change is already affecting human health. The WHO is estimating that 250,000 deaths a year are in some way, shape, or form attributable to climate change. So that's a really sobering statistic to come to terms with. And then I recognize also, and I really like this slide by David Hayes from NYU, because that notion of flattening the curve so successfully grabbed our collective imagination in the early phases of this pandemic. And I think the same is true in the context of climate change, making the case that our health systems will be overwhelmed. It's just a matter of time without appropriate action, and recognizing that here, even in Canada, where the vast majority of us are calling in from, we know that Canadians are already being impacted. Our health is already changing as a result of a changing climate. This isn't something in the future. It will only get worse in the future without appropriate action.
Yeah, well, I think you, well, thanks, first of all, for slide on demand. That was That was amazing. Well done.
A lot of Zoom practice over the last couple of hours.
Well, you know, I'm impressed. But I think what both you and Victoria have underscored is the power of metaphors and analogies in sort of trying to move the needle on this. We have a couple of more minutes left, so I just want to take maybe one or two more questions that have come in from the audience. So as a follow-up on the question about the separation between humans and the environment, and maybe Samira, you can take this. Can you speak a bit more about the separation of humans from our food systems in North America, for example, and how that can silo us from recognizing the importance of animal health? And how is this different from other communities or other cultures that do interact with food systems, you know, wet markets, of course, backyard farms, etc. So the connection is much closer, right? Any thoughts on that, Samira?
Yeah, I think that's one of the many ways we've sort of separated, or I guess drifted away from the natural world. And I think that we would probably temper our consumption if we were a little bit closer. I have to admit, I actually got interested in biology because we did have a backyard farm, and we used to pluck and clean chickens in the kitchen sink and grow our own vegetables. And you know, it's easy to say and do that when you know if you messed up, you could still go to the grocery store. And so I have to admit, it's a little bit idealized and very different from the people who really do depend on food that they produce or raise themselves. But I think that it's so true. We know now that particularly in North America, you know, the vast majority of the food that we consume is actually being generated by a very small proportion of intensified, I guess, farming corporations. Or so that's yet another way we've kind of lost. We did a little bit of work in swine barns with a small producer, and we're looking at the numbers then. And even over the last 20 years, in that particular, I guess with that particular commodity, there have been a significant reduction in the number of producers, but each of those producers have massive farms. And that also raises issues around biosafety and biosecurity, because if something gets into the, you know, that population, it decimates the whole operation. So looking at farming practices could be one way that we try and address this. Now, how easy that is to do, it's very challenging.
Yeah, no, well said. There's one question around sort of how, any thoughts that any of you may have on how the public and non-medical professionals can better be advised to dispose of PPE in a way that reduces leakage into the environment? And would this actually require government or companies to improve messaging or make things much more mandatory to prevent this form of pollution? So any thoughts on that? And I think that'll be the last question we can take. So maybe I can invite any of you to comment. Anyone want to take that question?
I'll just start briefly by saying when the supply of PPE was threatened, all of a sudden these means to reprocess it appeared. Why can't we do that all the time, and why weren't we doing that before? So I'll just start with that.
Yeah, no, it's true. I know just even in my own neighborhood, you know, a plant that was sitting empty was just repurposed completely to mass produce PPE because of this huge demand. Chris or Victoria, any comments?
I would just add to Samira's comment that in the same vein, now that we've got this ecological crisis in dealing with waste, why can't we move as quickly to be thinking about how we effectively recycle, reduce, reuse, repurpose these materials on the same type of scale in which they were produced in the first place?
Victoria, any thoughts?
And messaging around that would be fantastic if we're touching on the communications and the SciComm piece. Better communications about, you know, what to do with your masks, how to reprocess if you're going to use them, and, you know, the efficacy and safety of reusable cloth masks or face coverings.
Okay, great. Well, that brings us to the close of this session. I know we could be talking for hours about these issues, but thank you so much to our three fantastic panelists for spending the hour with us and sharing their wisdom with us. I just want to remind everyone that this is a two-part discussion. So in the new year, we'll be organizing another panel that will really be thinking about how the health system can be part of the Building Back Better agenda. and that will be moderated by my colleague Fiona Miller. And so thank you so much, Victoria, Samira, and Chris, for joining us today. I really appreciated your insights. And thanks to all the participants who joined.